What is metabolic syndrome or insulin resistance syndrome? Metabolic syndrome or insulin resistance syndrome or syndrome X is a cluster or group of conditions that altogether put people at high risk of diabetes, stroke, heart attack, kidney failure, heart failure, liver failure, cancer. The list goes on and on. I personally believe that metabolic syndrome or insulin resistance syndrome is underestimated. In America, for example, one person dies every 34 seconds from cardiovascular diseases or heart diseases. Cardiovascular diseases and/or cancer are always among the first or second or third leading cause of death. And metabolic syndrome or insulin resistance syndrome is the perfect foundation for those diseases. 1 out of 3 adults in America or globally has metabolic syndrome. And what is interesting is that many of those people do not even know they have it. So since you started watching this video, how many people are dead from cardiovascular diseases now? You do the math. Yes, that's how serious metabolic syndrome or insulin resistance syndrome is. Before we continue, please allow me to ask you a question. Have you been screened out for metabolic syndrome? Or does the hospital or the clinic or your primary care physician screen out for metabolic syndrome? I have lived in different states and I have also had different medical providers so far, but none of them have ever mentioned metabolic syndrome or insulin resistance syndrome to me. This is a syndrome that has sent so many people to the grave earlier, yet we don't hear about it much. In today's video, I am going to share with you relevant information regarding metabolic syndrome and show you how to screen yourself out for metabolic syndrome and how to take action if needed. Please make sure you watch until the end. Stay tuned. This is an outline of the rest of the presentation. Metabolic syndrome or insulin resistance syndrome has 5 different conditions. First, we are going to define each and every one of those 5 conditions. Second, I am going to share the good news about metabolic syndrome or insulin resistance syndrome. I am sure you're wondering what could be the good news about a syndrome like that. But there is definitely a good news about it that everyone should know. Third, I will share my mom's case and the whole picture regarding metabolic syndrome or insulin resistance syndrome. And last but not least, I will share the take-home message regarding metabolic or insulin resistance syndrome. Without further ado, please let's jump into the definition. Metabolic or insulin resistance syndrome has 5 different conditions, which are central or abdominal obesity, high blood sugar, high blood pressure, high triglyceride, and low HDL. If one has 3 or more of those 5 conditions, the person is more likely to be diagnosed with metabolic syndrome. Metabolic or insulin resistance syndrome by itself is not a disease. Instead, as we said in the beginning, it's a cluster or group of conditions, a group of risk factors that put people at high risk of the diseases we talk about. Let me point this out, please. Even it says that it requires 3 conditions or more to be diagnosed metabolic syndrome. I want to let you know that even if you have only 1 or 2 of those 5 conditions, please do not take it lightly. So the first condition we are going to define is abdominal or central obesity. Abdominal obesity is the accumulation of fat in the abdomen. Those fats have the tendency to form an apple shape on the man's belly and a peach shape on the woman's belly. If you look at those pictures, you will notice that the waist has a large circumference. There is a difference between abdominal obesity and generalized obesity. In central or abdominal obesity, the accumulation of fat is in the abdomen area around the organs, while in generalized obesity, The fats that are accumulated in the adipose tissue or fat tissues, which are actually the right storage for fat cells. Abdominal obesity is very bad. That's because the fat around abdomen or around the organs secretes pro-inflammatory markers or toxins that cause inflammation. The fats on arms and hips are neutral. They do not have pro-inflammatory markers or toxins that cause health risk. We do have 3 different parameters to analyze or identify or diagnose central obesity. The first one is the waist circumference that we just talked about. Ideally, the waist circumference in men is supposed to be 40 inches or less, and in women it's supposed to be 35 inches or less. This has a lot of limitations. We cannot rely only on this parameter to evaluate central obesity, but it gives us a general idea of where we are. Some people are naturally in the large size. They were born large. It's just their family history. And it doesn't have anything to do with metabolic syndrome, some ethnicity, some race. Waist circumference is just to have a general idea of where we are going, but it's a very good parameter to analyze central or abdominal obesity. The second parameter we do have is the body mass index, the BMI. It's mostly to identify generalized obesity instead of central obesity. It doesn't give any information on where the fats are located. The body mass index is the parameter that's most used in many health systems and is actually not really accurate. The third parameter, which is the one I recommend, is the waist to hip ratio. It also has limitations, but it's much better than the 2 previous ones we just talked about. It gives you indication of where the fats are located. And remember, we just said that the fats located on arms and hips are less dangerous. They are neutral. That's because they do not secrete inflammatory marker that cause problem for our health, compared to the fat in the abdomen or around the organs that secretes those toxins that poison our body and cause health risks. This is an illustration of everything we just talked about regarding central obesity. So central or abdominal obesity is different from generalized obesity. We said that there are 3 parameters to evaluate central obesity. The first one is the waist circumference. The waist circumference in men is ideally 40 inch or 102 centimeter less, and the waist circumference in women should be 35 inches or 88 centimeter or less. You can get a tape like this one and measure your waist circumference around your belly button, or you can get somebody measure that for you. So the second parameter we do have here is the BMI, the body mass index. Is from World Health Organization, WHO. It's the weight in kilogram divided by height square in meter square. So how do you calculate your BMI on your own? I know that you really do not have to calculate this because this is the one that's most used in the healthcare system. Most of the time we go to the hospital, they do the BMI. But here we encourage people to be on top of their health. So if you want to calculate your own BMI on your own, you just get a scale, you step on a scale like this, you read it in kilogram, and then you use a tape like this one for your height. You measure your height. When you have your waist and your height, you can either plug into a Google calculator to have your BMI, or you can do the math on your own. So if you want to know your waist to hip ratio, which I really recommend, measure your waist circumference just the way we talk about up here. Measure your hip circumference, and the hip circumference is going to be on the biggest part of your hip. Let's say, for example, this lady, if you want to measure the hip circumference of this lady, we're going to get it here, which is the largest part of her hip. So when you get your waist circumference, you get the hip circumference, you divide the waist circumference by the hip circumference. For example, let's say we measure somebody's waist circumference, the person's waist circumference is 55, and we measure that person hip circumference, and that person's hip circumference is 60. The waist to hip ratio for that person is going to be 55 divided by 60, which is 0.91. You really do not have to do the math here. When you have your waist circumference and your hip circumference measurement, you can plug into a weight to hip ratio circumference on Google. You just want to make sure here that you use the same unit. So if you measure the waist circumference in inch, also make sure that you measure the hip circumference in inch. If you choose to use centimeter, do the same for both, for the waist and the hip circumference. Now that we know how to obtain these parameters, how do we apply them to our health? Let's take a look at the two parameters we have here. The first one is the BMI, the body mass index. Here we have the categories. We have underweight, which is a BMI less than 18.5. We have the normal weight. You can see that is a green zone. That means that that's where the BMI is supposed to be. The orange one, which is overweight, a BMI between 25 and 29.9. And anything more than 40 is class 3 obesity. In this video, I am using color. So each time I will say something in the green zone or you will see a green color, it's where everyone is supposed to be. The other parameter we have here is the weight to hip ratio. We will see that it has 3 columns, the health risk, women and men. One of the difference between BMI and the waist to hip ratio is that the waist to hip ratio categorizes women and men. For women, the waist to hip ratio should be 0.80 or less, and for men, it should be 0.95 or lower. When you get down here, we will see the moderate health risk. Moderate is between 0.81 to 0.85 for women and between 0.96 to 1.0 for men. This zone is like a warning zone. It's where we need to lose weight, we need to change our lifestyle to go back to the green zone. And we have our red zone here. The health risk is very high. We do not want anybody to be here. If you're here or any of your loved one is here, you want to make sure that you work really hard to go back to either the yellow zone and ideally to the green zone. Now that we know how to screen ourselves out for central obesity or abdominal obesity, let's talk about a few things that cause central obesity. Genetic is the first one I am going to mention here. It's good for us to know our family history. I do have a very detailed video regarding central or abdominal obesity. If you want to know more detail regarding central obesity, please watch that video. So the second condition of metabolic syndrome we are going to define here is high blood sugar. High blood sugar or high blood glucose is an abnormal level of sugar or glucose into the bloodstream. Normally, when we eat, the beta cells from the pancreas secretes insulin, which help us store the extra glucose or sugar into the cells. The insulin hormone is like a key like this that opens the cell doors in order for the glucose or sugar to get into the cells. When the cells become resistant to insulin, meaning keys are no longer able to open the cell's door, the glucose or blood sugar after a meal rich in carbohydrate have no other choice but to stay into the bloodstream, and as a result there is high blood sugar or high blood glucose. This will eventually lead to diabetes if no step is taken. At this stage, the blood sugar or glucose is high, but not high enough to be diagnosed with diabetes. It's at the pre-diabetic level. The A1C at this stage is probably between 5.7 and 6.4. If you take a look at the table, you will notice that there are 3 colors. One is green, one is yellow, and one is red. The green one is where everyone is healthy. The A1C is green, it's less than 5.7. The high blood sugar we are talking about here, which is a condition of metabolic syndrome. It's a cutoff line to type 2 diabetes. If you look at the red column, it's going to be type 2 diabetes. So high blood sugar, which is part of the metabolic syndrome, is at the cutoff line to type 2 diabetes, and you really do not want to go there. You do not want to cross that red line, to get to the red column. What you want to do here is either stay where you are at the yellow, and the best for you would be to go back to the green. I do have a detailed video regarding type 2 diabetes and insulin resistance. In that video, I explain how type 2 diabetes is contracted and how type 2 diabetes can be reversed without the use of medications. If interested, please watch that video. It's full of information. The third condition we are going to define is hypertension or high blood pressure. Hypertension is the flow of blood through the arteries at a higher pressure than normal. It has two different components: the systolic pressure, which is the pressure when the ventricles pump blood out of heart to our organs, and the diastolic pressure, which is when the heart is resting or filling up with blood from our organs. The normal blood pressure for male adults is around 120/80 millimeters of mercury. Blood pressure may vary according to the physiological state. For example, if you're sleeping or resting or exercising, the blood pressure is definitely going to be different, but you have your baseline blood pressure. So the blood pressure we are talking about here, the high blood pressure for metabolic syndrome, is at the cutoff line of the normal range. It is not high enough to be diagnosed with high blood pressure or hypertension, and yet it is not low enough to be considered normal range. The condition of metabolic syndrome we are defining here is the yellow line. High blood pressure is mostly caused by stress, insulin resistance, and diet. Of course, genetic will always be there. I do have a detailed video regarding hypertension. That video explains how hypertension is contracted and how hypertension can be reversed without the use of medications. You can check it out if you're interested. Our fourth condition is elevated or high triglyceride. Triglycerides or free fats are not supposed to be in the bloodstream. But when blood sugar is elevated because of insulin resistance, the body has no choice but to turn the extra glucose into triglycerides. When the fat cells are too full, they shed some free fatty acid or triglyceride into the bloodstream, which is not normal. The human body is built in such a way that each time something is at the wrong place at the wrong time, there is a big problem, instantaneously or acutely or in the long run. For example, when we talk about high blood sugar, which is sugar or glucose in the bloodstream, glucose or sugar in the bloodstream is not a problem. Actually, we do need glucose or sugar in the bloodstream in order to live. We cannot live if we do not have glucose. It becomes a problem when we have too much glucose. When we eat a meal with carbohydrate, it is very normal for the glucose to be high into the bloodstream. After a couple of hours, that glucose is supposed to be stored into the cells and not in the bloodstream. Generally speaking, in life, we do not want to be at the wrong place at the wrong time. It is the same thing with the triglyceride or free fatty acid or free fats. They are supposed to be stored into fat cells, and into the bloodstream, they will always cause damage. The normal triglyceride range is 150 milligrams per deciliter, or less than 1.7 millimoles per liter. The last but not least condition is low HDL, also known as good cholesterol. HDL stands for high density lipoprotein. High density lipoprotein or HDL collects LDL, also known as bad cholesterol, from the bloodstream. Some cells of our immune system called macrophages engorge those oxidized LDLs that form plaque inside the blood vessels that will eventually lead up to heart attack or stroke. High triglycerides and low HDL will eventually lead to hyperlipidemia or abnormal cholesterol if no step is taken. Now that we have a good understanding about metabolic syndrome or insulin resistance syndrome, let's talk about the good news about it. The good news about it is that it's totally reversible. we can reverse it. I am not saying that reversing it is easy at all. No, it's not a piece of cake. It requires a total lifestyle change. Before I expand more into that, let me share with you my mom case. When I left Cameroon a few years ago, my mom was fit, slim, totally healthy. She came to visit me last year. At the airport when I saw her, she was a totally different person. The peach-shaped belly we talked about earlier was obvious with her. Mom felt fantastic. Her main concern was the fact that she wasn't able to wear those slim shift dresses that she used to wear before because of her belly. A few months later, we went to the hospital just for her checkup. She didn't actually have any problem. That was just for the regular checkup. They drew blood, they ran a lot of labs and gave us an appointment to discuss the results with us. 2 days later, the lab's results were on the portal, on the app, available for us to view. When I displayed her result on the app, the first thing I looked at was her metabolic panel. Her A1C was high. Remember, we just talked about A1C when we define high blood sugar. Her pre-A1C wasn't at the level of diabetes, but it was the pre-diabetes level. She was not at the healthy stage anymore. And as I have already mentioned, her central or abdominal obesity was obvious. We were grateful of the fact that we knew that we had the information that she had that syndrome. And also the fact that we knew what metabolic or insulin syndrome resistant was, because there are so many people out there that do have metabolic syndrome and they don't know they have it. And then there are some other people, they do know they have it, but they don't even know the risk that has on their health. I exclaimed, "Mom, good news! You do have insulin resistant syndrome." After explaining to her what insulin resistant syndrome or metabolic syndrome was, she asked me this question: "So what is good about having a syndrome that would send me to death earlier?" And I brought up the fact that insulin resistance is a syndrome that is totally reversible. Mom promised to herself that she would do what it takes to reverse that condition. We assessed her case, we discussed about her lifestyle modification, and came up with a plan on her new lifestyle. So before we went back to the doctor office to discuss the result with the provider, we have already made plan on what mom would do to reverse her insulin resistant syndrome. When we got back to her provider's office, her provider, a sweet, nice nurse practitioner, said with a nice, calm voice, "Ma'am, your lab results look good. You only have a slightly elevated A1C and a few numbers on your lipid panel that are not good. You can do lifestyle change, or I can prescribe you a medication that would bring your A1C to the normal level." I was surprised that she offered medications. I thought that she would challenge my mom with the lifestyle modifications first, because mom didn't have any underlying conditions. She didn't have any condition that was bringing her A1C or her cholesterol level high. And mom was only in her middle 50s. She was just a perfect candidate for me, in my opinion, for lifestyle modifications instead of medication. I am a doctor of pharmacy, a medication expert. So get this from the medication expert's perspective or standpoint. Do not take a medication you do not need. Many people take medications they don't need. Please, do not get me wrong. I'm not saying that medication is not good. I am saying that medication is good only when required. My doctor prescribed this medication because my blood sugar was high. What do you mean I do not need it? We do need to understand this. Each time we ingest or take a medication, we are also getting all the side effects of that medication. Each medication has two sides: the good side or benefit and the bad side, which is the side effect. We take medications only because the good or benefit outreach or outweigh the bad or risk. At the metabolic syndrome or insulin resistance level, our body is asking for our help, and we do have two options. The first option is giving the help our body needs naturally by lifestyle modifications, and the second option is giving our body a medication or a drug which the body does not actually require or need at that moment. The body is saying something like this: look, I have been working hard since you were born to keep you healthy, but at this moment I am really tired. I cannot keep it up anymore. The body at this moment is asking for natural help. The body at this time is not asking for medication. No. The body at the level of metabolic syndrome is actually saying, please change that diet, reduce or balance your level of stress. Those processed food, high carbohydrate food that you have been eating, that you have been on since you were born, please, I cannot handle that anymore. My mom denied the prescription medication that was offered to her and stay with the lifestyle modification that we planned before we went to the hospital. And she is doing very well now. She changed her diet. She also got into so different physical activities. Before she traveled back to Cameroon, she lost so much weight. She could tell by herself because a lot of her clothes were loose on her. Her A1C went back to the normal range. The only concern we had for her when she left was her central obesity. We are planning on working on that when she comes back here. We are going to do some low carb diet, maybe keto or just low carb diet with some intermittent fasting. And then when she gets back to her normal weight, she will decide if she wants to be on those low carb diet for life or if she's going to switch it to something different. I share mom case here just to encourage anybody that has metabolic syndrome to understand that the syndrome can be resolved naturally without the need of medication. My mom did that. It's doable. At the level of metabolic syndrome, we do not need medications. If you are getting some value from this video, please like it. It makes a difference. Hit the like button, please. Thank you. If you have been to a hospital or clinic that screened for metabolic syndrome, please comment down below and share your experience with us. Many hospitals or clinics do not have metabolic syndrome or insulin resistance syndrome in their standard screening protocol. I guess that's because metabolic syndrome is not a disease. Yet, that syndrome remains the main factors for health risk. Let's move on to the whole picture of metabolic syndrome on the board. So this is the whole picture of metabolic syndrome. This picture is very important. You can take a picture of it and share it with your friends, your family on Facebook, just to let people understand what insulin resistance or metabolic syndrome is. We have healthy, which is actually healthy, and we have this second healthy, which is not healthy, because many people look physically healthy when they do the lab work. The lab shows that everything is fine, but those people are not healthy anymore. When you have an A1C which is less than 5.7 but which is around 5.5, 5.4 or 5.66, yes, you are here. Your lab result is not flagging your doctor system, your medical provider system, that you have an issue, but you are actually here because with an A1C of 5.5, 5.6, even if the lab results say that you are healthy, you are here. You are healthy in the yellow color, not healthy green color. From healthy, we move to metabolic syndrome or insulin resistance syndrome. So we go from healthy to here. From healthy here, we go here. We move from healthy yellow, actually, we move from yellow healthy to insulin resistance syndrome or metabolic syndrome. And I put the different conditions of metabolic syndrome in here. So insulin resistance syndrome or metabolic syndrome, as we defined earlier, has these 5 different conditions: central obesity, high blood sugar, high blood pressure, high triglyceride, or low HDL. If after metabolic syndrome we do not do anything, we're gonna get here. If you have central obesity or high blood sugar, it's gonna probably lead to type 2 diabetes if no further step is taken. High blood pressure. You remember we said that high blood pressure was an elevated blood pressure, but just at that cutoff line. It wasn't high blood pressure, which is a condition of insulin resistance syndrome. It's not high blood pressure yet. The blood pressure is elevated, but not elevated enough to be diagnosed with hypertension. High triglyceride and low HDL is going to lead to dyslipidemia or high cholesterol. This is also very common in people with insulin resistance. So insulin resistance is also going to cause a polycystic ovary syndrome, PCOS, which create a lot of problem with some women trying to conceive. Sexual dysfunction is another common one. Yes, insulin resistance syndrome will also cause sexual dysfunction. And sexual dysfunction is very common in people with central obesity, and also very common in people with type 2 diabetes. So central obesity, high blood sugar, or type 2 diabetes most of the time are also going to lead to sexual dysfunction. Everything in red color can be reversed without taking a medication, whether it's any condition of metabolic syndrome or these diseases. I'm not going to talk about sexual dysfunction or PCOS, but as long as something in red here is due to insulin resistance syndrome, if you reverse the insulin resistance, if you make your insulin sensitive, you're going to reverse that condition without the need of any medication. My YouTube channel is about everything here in red, but sexual dysfunction and PCO. My YouTube channel is about metabolic syndrome and these conditions that can be reversed without the need of any medication. I always tell people to be on top of their health. You are the ultimate person responsible of your health. Your healthcare system or your healthcare provider is only there to help you. Take action for yourself and your loved one. And I have a few things here that I am going to share with you to take action if you are not aware of those. The first take-home message I have here is the waist to height ratio. Do you know your waist to height ratio? According to recent studies, the National Health Service in England recommends that our waist should be half of our height or less, meaning that if somebody height is 5 feet or 60 inches, the person's waist should not be more than 30 inches. Knowing the waist to height ratio is very simple. If you use a tape like this, you measure your height from head to toe, and then you measure the waist circumference as we did before. When you get your two values, you can either go online on Google Calculator. There are waist to height ratio calculators on Google, or you can do the math by yourself. You can divide the waistline that you obtain by your height and you're going to get that ratio. Let's say somebody's waistline is 30 inches and the person's height is 60 inches. The person's waist to height ratio is 30 divided by 60, which is 0.5. Here is the reference chart. Brown is all the way up to 0.39, which is underweight. From 0.4 to 0.49, it's healthy. We have 0.5 to 0.59, which is the yellow zone. We have our red zone, which is the zone that put people at very high risk of heart diseases, stroke, cancer, everything that we saw on our board. The second take-home message I have for you is to be able to evaluate yourself or your loved one for metabolic syndrome or insulin resistance syndrome. And how do you do that? You already know by now that it has 5 different conditions. The first one is central obesity. We already talked about how to screen yourself for central obesity from home. The second one is high blood sugar. How do you know if you have high blood sugar? Of course, if you ask your doctor or your medical provider what your A1C is, he or she will definitely tell you. But in this video today, I am encouraging people to be on top of their health. For example, the A1C for pre-diabetes or for high blood sugar we are talking about here is between 5.7 and 6.4. If your A1C is 5.5, your doctor is less likely to say anything about it. Why? Because that's in the normal range. But take a look at that chart from the American Diabetes Association. You'll see that 5.5 is still in the yellow zone. You are in the yellow zone. You are not really healthy. Your blood sugar is high. So if your A1C is consistently close to 5.7, you really need to do something about it. Even if your doctor doesn't mention it, you really need to work it out, because you are not in the green zone, you are in the yellow zone. And when it comes to anything related to diabetes, you really want to take it seriously. When the A1C is consistently elevated, even if there are no many studies out there showing correlation between elevated, say, A1C and insulin, I still believe that consistent elevated A1C is still due to insulin resistance. So as a take-home message here concerning high blood sugar, make sure that you know which zone your A1C is in. The third condition is high blood pressure. And how do you screen yourself out for high blood pressure? That's very simple. You just get a monitor and you check your blood pressure consistently at home. The fourth and fifth conditions are elevated triglyceride and low HDL. HDL stands for high density lipoproteins. We are going to combine these two because both lead to dyslipidemia or abnormal cholesterol. So when we get our lab result, we are going to look at the lipid panel. When we look at the total triglyceride and the HDL, we are not looking at those values individually. Instead, we are going to look at the ratio. We are going to divide the triglyceride by the HDL and we will take a look at the ratio. The lower the ratio, the better the health is. When I was doing research for this ratio, I got confused because some studies said that the normal ratio should be less than 2. Some other studies say the normal ratio should be 3 or less. And some other studies say that in African American or Black, the ratio should be 1.5 or less, and in Caucasian, it should be 1.8 or less. And I got confused. I don't know exactly what is the normal ratio for triglyceride to HDL. Please do your own research on this. Please hit the like icon if you are getting any value from this video. That makes a difference. Thank you. My last hint for the take-home message is to take action. If you do have metabolic syndrome or insulin resistance syndrome and you want to reverse it naturally, these are my hints. Number 1, balance your stress life. If you do not do anything about your stress level, it's going to be really difficult. The second one is the diet. The diet is like the elephant in the room. And when we talk about diet here, it's not only processed food or fats. No, it's also healthy carbohydrate. Too much carbohydrate would lead to insulin resistance, even if they are healthy carbohydrates. My mom had metabolic syndrome. She lived in Cameroon all her life and she did not eat processed food. 80% of the diet in Cameroon is made of fresh food. Only 15 to 20% could be processed food. And many people do not even eat those 15 to 20%. My mom did not eat processed food. She mainly ate healthy carbohydrate and she did not eat fat either. So her own issue with diet was too much healthy carbohydrate. The good diet to reverse insulin resistance is low carb diet. Actually a very low carb diet. And you really don't have to be on that diet for all your life. You can get yourself restricted to a low carb diet. You reverse your insulin resistance, and then when you are insulin sensitive, you can go back to your diet and just change a few things. But in order to reverse insulin resistance, you're gonna have to change dramatically something on your diet in order to get there. Some people do keto, some people are doing intermittent fasting, some people are counting calories. Find something that works for you. My third hint is physical activity. And what I like about physical activities is that it improves the overall health. It improves the quality of sleep. And by physical activities here, I mean you are going to exercise consistently. You are not just going to work out when you feel like. It's not going to work. In order for the physical activity to work and help you reverse your condition, you really have to do it on a very consistent basis. Those are the main ones. Of course, sleep is very important. If you're a smoker, you need to quit smoking, and if you drink alcohol, you really have to reduce your alcohol at a very low level. Now that you know everything about insulin resistance syndrome or metabolic syndrome and how to screen yourself and your loved one and take action, please like and share. I also invite you to watch my videos regarding central obesity, type 2 diabetes, high blood pressure or hypertension, and abnormal cholesterol or hyperlipidemia. It has a lot of information. In my next video, I will be taking you to my kitchen to share with you my low-carb diet recipes. I will be also creating informative videos like this to help us stay on top of our health. If you or your family have some conditions of metabolic syndrome, please drop in the comment below what you are doing as lifestyle modification to reverse those conditions. I do invite you and encourage you to screen yourself and your loved one for metabolic syndrome if you think that you are at risk. And if you have any questions regarding anything I say in the video, please send me a message to my Instagram. Please subscribe if you would like to get more content from me in the future. Life is so stressful. Please share love around you. Smile can make a difference. Smile to a stranger you don't know in the parking lot or in the mall. Thank you so much for watching. I really do appreciate your time.